Hello, everyone. I'm Janelle Mose, the Advocacy Director with AARP North Dakota. AARP has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP has canceled all of our in-person events until the end of the year. But we're finding other ways to continue to provide information and resources to help older adults and those caring for them. The rising cost of prescription drugs impacts not only AARP members, but all North Dakotans. In AARP's 2018 voter issue survey, 98% of voters aged 50 and older told us that candidates' position on lowering drug costs was important to them, with 74% labeling it very important. In addition, 28% of people who face the cost of the medicine they need chose not to take it, not to pay for it. That's more than 1 in 4. With me today is Representative George Keiser, the chairman of the Interim Health Care Committee. Representative Keiser, thanks for joining me today.
Well, thank you for having me on your program, Janelle.
Absolutely. So Representative Keiser, can you tell us a little bit more about the Interim Health Care Committee and the studies that were assigned to you this interim legislative session?
Well, basically, Janelle, the Interim Health Care Committee during the interim studies all sorts of health issues. The one that I think is most relevant to your membership is the cost of drugs and what can we do legislatively to address that issue. Our committee had its final meeting last week, and we did send out 3 bills. One of them is the prescription drug cost transparency bill. It will be going to the legislature this coming session. And at the end of our little presentation, I will really be asking for the support of you and your organization and membership, because it is critical that we get this legislation passed. What it simply does, and it's a complex bill, but I'm going to try and reduce it to what it basically tries to do. This bill will affect drug manufacturers, pharmacy benefit managers, health insurance companies, and drug wholesalers. Those are the 4 players that impact, directly or indirectly, the cost of drugs that we, the citizens of our state, pay for. Let's break it down for each one of them. For the drug manufacturer, they have to provide a wholesale acquisition cost for each of their drugs. That's what the drug costs. And in any situation where that drug increases in price of 40% or greater over the last 5 years, they have to identify that drug and provide a rationale as to why that happened. For drugs that increase in price more than 10% in a single year, the same holds. The manufacturer they can do it. This isn't preventing them from increasing their prices at all. It's just if you have that level of increase, you have to report it and provide a rationale for why that is happening. Now, in introducing a new drug to the marketplace, prescription drug, if the cost is greater than the Medicare deprogram price for that drug, they have to also provide, again, a rationale explaining what factor or factors are affecting the cost of that drug at that time. This information will be provided on a quarterly basis to the insurance department, and the insurance department will be compiling and placing on their website this information in hopefully a very consumable and easily accessed form for folks. PBMs, which are a major player in this whole situation, also impacted. And what we really want to know is from the PBMs is, and I have to refer to some notes here, what are the aggregated rebates, fees, and price protection payments, et cetera, that are collected from the drug manufacturer? As I think your audience recognizes, when PBMs get involved as that middle person managing these accounts, they sometimes work with the manufacturer and say, we'll put your drug on our list, our formulary, but in order for us to do that, we want a rebate, we want a kickback. And what we're not saying that's occurring right now, we're not saying rebates are illegal. What we are saying in this legislation is report them. Let us know what they are in aggregated form. So we're okay there. The it's important that we have this information. It results in millions and millions of dollars. One might ask the question, why have rebates? Why not just manage it and take rebates out and reduce the overall cost? But that is the way it is. And the same applies really for insurance companies. What kind of rebates are they collecting? What kind of additional penalties or fees are they receiving as a result of putting it on their plans? And then PSAOs, which are the wholesaler group. Today, there are, I think, 3 or 4 wholesalers that are basically the manufacturer makes a drug, distributes it to a wholesaler, and then the pharmacists actually order from the wholesaler, not directly from the manufacturer. And so in that situation as well, Janelle, we're asking for basically the same kind of information. What kind of rebates, what kind of fund transfers are occurring internally that we don't know about? You can do them, but let us know about them so we can monitor them and determine whether or not we think they're appropriate. There's a lot going on in the background on drug pricing. And this bill is simply step one of addressing the issue of cost of prescription drugs. Let's get some information out there that the public can see and allow us the opportunity to say, why? Why are you doing this? Why do we have these increases greater than 10%, greater than 50% over a 5-year period? There may be a very good justification, and that's fine. But frequently, I like to say in healthcare that the charges that are charged sometimes are simply because you can. We simply can do it, so why wouldn't you do it? And without understanding these things, having information available to the public, we cannot begin to get a handle and address these issues. Now, this is the ask I have of all of your membership and of you, Janelle. This is one of those bills. If you were at our hearing when the committee passed this, the medical association, the hospital association, the pharmaceutical companies, the PBM representatives, everybody was there opposing this legislation. They do not want this legislation. When it comes to the legislature, there will be more lobbyists flown in for this bill than maybe any bill that the legislature hears next session. The way we pass this kind of legislation in the heat of this debate is from local grassroots operation. If we can get your membership to go to every one of our legislators and say, we want this, we are asking for it, we're actually demanding it, and we're watching, and it will influence us and how we vote. That's the only way this is ever going to pass. I can tell you right now that of all the bills we hear next session, this will probably be the most resisted from all of the organizations of any bill we'll hear. So that's my ask of your membership. We need them. It can be done. Now, some states have passed it, and it has slowed down the increase of drug pricing in those states. We'll have that data available for the hearings, and we can also provide it to your membership as we collect it. But we're anxious to get going on this project, and we're going to fight the fight. That's for sure.
I think you made some really important points. We have a very engaged membership here in North Dakota as well as across the country. And I receive phone calls just in my short time at AARP from our members talking about the daily impact the cost of prescription drugs has on their lives. And I think, as you indicated, this is just one step in the process, that being able to have a transparent process to understand the cost of prescription drugs and why it may be increasing year to year, I think is an important point. And the other thing is, we do have a citizen legislature, and I think an important part of this process is hearing from constituents and hearing how this impacts them on a daily basis. So do you anticipate, as we look towards the legislative session, are there going to be alternative ways for our members to be involved in this process if they feel like they can't be there in person?
Well, absolutely. Number one, all of the legislators in this state live in their communities. And especially in some of the small communities, your membership knows where they hang out, where they go to coffee on Saturday or whatever. They don't have to wait for the session to come up. This bill is now in the hopper. It is coming. I don't have a bill number yet. That has not been assigned. But the issue is going forward. This is the time to start the conversation, and don't let them off the hook. I will say this. There are some of your members, I believe, that when this legislation was on the agenda, some people looked at it and did start contacting their legislators by email. And email is something that all of the legislators attend to. It's unfortunately, though, the battle is going to be a difficult one because these lobbyists are going to come loaded with all sorts of information as to why this is a bad idea. It will disrupt the pharmaceutical system in our country. It will destroy our current system. It doesn't do any of that. It does ask for transparency, and that's okay. Anytime somebody opposes transparency, I have to challenge or question what is their motive for that. And it's because there are millions, hundreds of millions of dollars involved in the background in these transactions.
On a final note, before I let you go, you indicated that other states have passed this type of legislation. Do you feel like they felt the same significant pushback on this type of legislation that we are anticipating going into January?
Absolutely. They went through the battle. They warned me about that, and they said, "Be prepared because this is one of those that all efforts are made to block this legislation, and they have lots of money, lots of professional people that are very good at explaining their perspective. But when it comes down to it, there's no one better than the citizens represented by our legislators. They can do a good job, and will be effective if they work at it."
Well, that sounds great, Representative Keiser. I really appreciate you spending time with us today, and this has been really helpful. So thanks again for joining us. Is there anything else that you want to cover before I let you go today?
No, I think that's enough. We look forward to seeing you in whatever format we're going to be under when the legislature does come around. But we really appreciate your efforts on behalf of the drug pricing issue in our state.
Well, thank you. Thanks again. So for our viewers, just a few reminders about AARP's coronavirus resources and how to stay connected with us right now. You can find us on Facebook at facebook.org, AARP North Dakota. You can like our page and you'll see other things coming up in the next few months in preparation for the legislative session, as well as looking towards the November election. You can also find updates on our website at aarp.org ND. Thanks again for joining us. Stay connected with us here online, and we'll see you very soon.